Doctors, come on up here. So Denise Fair and I are joined by Dr. Mark Zervis, the Chief of Infectious Disease for Henry Ford Hospital and Assistant Dean for the Medical School, and Dr. Kate Reyes from the Infectious Disease Department of Henry Ford as well. We have got, I think, the finest expertise in Michigan advising us every step of the way. With last night's announcement that there were 12 people in Michigan diagnosed with COVID-19, and then the recent announcement a little while ago that we're up to 16, including the first one from the city of Detroit, it's clear we've moved to a different stage. When I stood here 24 hours ago, there were 2 patients who both had travel history. What we now know is that we have a stage called community-acquired infection. We have people getting the coronavirus by other people in the community. And that means a whole different level of strategy and a time to shift gears. And it's why we completely support what the governor has done, both in limiting the assemblage to 250 people, in closing the public schools. We need to deal with that community-acquired infection, and we need to be completely honest about what we're facing. This is not going to be over in a few weeks. This is going to be a several-month battle to deal with the coronavirus issue, and it's going to take a very intense strategy because coronavirus is now embedded in the Michigan community. There are almost certainly a large number of Michigan residents who have the virus who have not yet been tested. And very likely they have such mild cases they thought it was a bad cold or the flu, but one way or another, the testing has been so limited that the numbers that you're seeing today at 16 are clearly only a small piece. And so what we want to talk about is the fact that we have to be prepared that the number of diagnosed COVID-19 cases is going to grow dramatically in the coming weeks and months. And winning the battle means slowing the growth. I know that doesn't sound intuitive, but it's true. What we want to do is slow the growth, and let me try to explain why. Every year in this country, there are 35 million people who get the seasonal flu, and between 30 and 60,000 die. It's something that folks in infectious disease understand. There is something about the COVID-19 virus, and Dr. Zervis will talk about it in far more technical terms than I ever could, that with some healthy adults who don't have immunity, it is causing such breathing problems that they die. Now, in southeastern Michigan, we have a number of the finest hospital systems in America. We are blessed here to have Henry Ford and DMC and Ascension and Trinity and Beaumont all here. The great majority of patients have mild enough cases they don't need hospitalization. The ones who do need hospitalizations, the great majority of those can be treated by our hospitals until their bodies fight off the disease. The real risk, and what's happened in some parts of the world, is if too many of the cases come too quickly and the hospital capacity is exceeded, now we don't have the best care for those patients. And so what Dr. Zervis and I are going to talk about, we're going to continue to talk about, is what we need to do is slow the growth of this virus so that the outstanding medical care in this community is readily available to everybody who needs it. And that means as a community, we're going to need to function in everyday life with the coronavirus while at the same time minimizing the risk of growth. We're going to have to learn a different way to live. You're not going to be able to hide out for 2 or 3 weeks and this is going to be gone. That's not a likely outcome. And as I've said many times here, the single best thing that you can do to slow the growth is be responsible to your neighbors And if you have a fever or coughs or shortness of breath, stay home. That's the single best thing that we can do. But if you don't have those symptoms, you don't have to stay in your house. And we want to talk today about going out in public gatherings. And what we want you to avoid are the kinds of public gatherings where you're in compressed spaces, dense group of people, where folks are within 6 feet of you. The exchange of breath, sneeze, coughing is driving most of this. So, for example, last night I went out to Buddy's Pizza downtown that was half empty, ate dinner. That was a very low-risk activity. I would not go out this weekend to a pub on Michigan Avenue for St. Patrick's Day where I was packed in shoulder to shoulder. In that kind of interaction, you're engaging in a very high-risk activity. Walking your kids in the park is going to be, I would hope, a normal activity. Taking the kids into a crowded aquarium inside is, again, likely to put you at higher risk. And so we need people to make choices, not to stop living your life, not to stay in your house, but to recognize which activities are high risk and which activities are low risk. We are going to also do our share to contribute. Starting tomorrow, the Detroit recreation centers will be closed and will remain closed through April 5th. Those are areas where we could have had large numbers of people concentrating in close quarters, and so they will stay closed concurrent with the closing of the public schools. We have 40 employees working there, and as I tell you in a second, we will have good use for those employees. We're not laying them off. As you also know, the schools are closed. I'm pleased to tell you that I've talked to Dr. Vitti, and DPS is taking the lead on making sure that the students at those schools eligible for the school lunch program will have their meals, both breakfast and lunches, provided and made available during the period that schools are closed. And we are going to go a further step and come up with food for the families of those children. And I want to thank United Way, Gleaners, Forgotten Harvest, and the Detroit Children's Fund, who have all agreed to contribute to this. And we are going to take our 40 recreation center employees, and they will be part of the food distribution network as long as the schools and the rec centers are closed. But we are not going to leave our children and poorest families vulnerable for a lack of food. Testing for COVID-19 has been restricted by the limitations on the number of test kits and limitations on the authorized laboratories. But those restrictions appear finally to be easing. We all know they're overdue, but it has really handicapped this country's ability to respond. And we're hoping that those problems will be eased by the end of next week. And so, because we're in the community-acquired stage, it is inevitable that the number of positive COVID-19 patients is going to increase, and our job is going to be to make the testing that's done in the Detroit area the most aggressive in the country. We want the number of positives to increase as fast as possible. I know this doesn't seem right, but it is. We can't treat people until we know who they are. And it is my intention for the Detroit area to lead the country. I've talked to the leadership at Henry Ford, DMC, and Ascension Health. I'm convening the hospital leaders here next Monday. And I am going to strongly encourage them to set up drive-by testing sites. I think within a week or two it should be practical. Because if you have these symptoms, the last thing we want is for you sitting in a doctor's waiting room or in an emergency room making other people sick. But it is possible to have medical assistance in places where tents are set up, where you could drive up, get a nasal swab, drive off, we could get it tested quickly. And a number of the hospitals have mobile vehicles, and I've talked to them about getting out to the homeless shelters and the nursing homes so that everybody in this city can be promptly tested. The sooner that we treat these patients, the better their prognosis is. And if you've seen the numbers so far, there's at least as of this afternoon, roughly 400 positives in the states of New York and Massachusetts, and so far not a single death. Part of that is that we're in the early stages. Part of that is New York and Boston have some of the finest hospitals in America. And we have that kind of capability here if we can, in fact, identify the patients early enough. And so if we do our jobs right, you should see a rapid increase in the number of people tested positive. And if we can get them into these hospitals, we can change the course of this very difficult time. The battle against coronavirus is going to be waged for the next several months, and I'm really pleased that we have a new general in this battle. And so somebody that I think you'll be very interested in hearing from, please welcome Dr. Mark Zervas.
Thank you very much. It is, we've learned a lot about the virus since it was first identified in China, now back in November of last year. And the initial patients were, of course, first, that we saw in the United States were first travelers from other countries, but now there's very clear evidence in the United States, and including Detroit and in Michigan, that there are what we call community-associated cases, meaning that there's person-to-person transmission that is occurring outside of hospital settings, outside of somebody who's traveled from another country. And that is very important for a variety of reasons, and with the identification of now, I believe we're up to 16 patients in Michigan, that clearly indicates that there's been community spread. We have been limited by having limitations of not having testing available, but those limitations have lessened. We do have testing available now. The state health department is doing testing. We still work through the local health departments, and some of the hospitals will be working towards developing tests ourselves so that we can do it more quickly, and also mechanisms that we can get people tested by things like drive-throughs so that we can protect the patients and also the healthcare workers. It is very important to identify people that are infected, because when we identify people that are infected, not only can we better treat them, we can treat them early and reduce the serious complications, but even more importantly, we can implement control measures. And we can do it rationally. So if we know that there's an increase in cases in one particular community or not, then we can push very aggressive measures to control the infection in that area. The measures that have been recommended so far they're appropriate. They're what we should be doing. At this point, having community spread, we should be moving towards and doing the closures of the schools, limiting large gatherings. But it's still important to remember that on an individual basis, hand washing, social distancing, not being too close to somebody that's coughing or sneezing, it does remain important. A really big, important recommendation that we hear over and over again, but it is one of the most important things we can do is not come to work, not go to a public place if one is sick. And now we're in a position to also evaluate somebody to see if they have COVID-19 or not. It's still important to remember that there are a lot of things that can cause flu-like symptoms, including influenza itself, which we're still seeing in Michigan. We see other viruses that can have very similar symptoms. This is not the flu, but it does have some similar symptoms. But the vast majority of people that have this illness will be either no symptoms, mild symptoms, symptoms that are not severe enough to come to the hospital. What we've learned so far is about 20% of people with the illness will come to the hospital and require medical care. The mortality from it, we're still learning about it, because in parts of the world where more testing has been done, for example, in Korea, where more testing has been done, the mortality has been shown to be relatively low, 1%. So, and if we're not testing people that are asymptomatic or that have very mild symptoms, then that results in an or an overestimation of the potential for mortality. We can beat this virus. We can defeat the virus. It is necessary, however, for us to really fight the battle in ways that include things like closing schools, unfortunately, and limiting gatherings. But it's also important to have to not to overreact in ways that don't make sense either. So, for example, I was out to dinner, twice this week in Detroit. I saw no problem with going out to dinner. I plan to go to church this Sunday. So there is no reason to overreact either, but we do need to use common sense types of measures. We do need to limit the large gatherings. We need to, I think it was very appropriate to close the schools and that type of thing, but not to overreact or do things that are not necessary or don't make sense from a control point of view. We are going to see more cases, and the thing that is very important about identifying more cases is then we know how to implement control measures that are rational, but also to be able to treat patients early. And I think New York, Boston's experience is an important one for us because through earlier identification of patients and through outstanding medical care, which we also have in Detroit, I think we can impact the severity of the illness. Be glad to answer questions later if there are.
Thank you, Doctor. Go ahead.
Dr. Zervos, thank you so much. I know your leadership and your medical guidance has been extremely valuable. So we are working really closely with the governor's office and have been over the past several days, and we definitely appreciate the governor's leadership on this issue and for keeping us so well informed. I fully support the restrictions the governor announced limiting public gatherings and venues such as halls and theaters, cafeterias, and galleries. As I mentioned yesterday, as a community, we have an important job, which is to slow the spread of COVID-19. And as Dr. Zervos said, we can beat the COVID-19, and we all have a role to play. Now, this new policy gives us practical guidelines that we all can follow. Now, I realize this is going to pose an inconvenience. We know, but this is a necessary one to slow the spread. But if we all work together and we follow those important guidelines, we can make this a short-term problem instead of a long one. Now, by now, you've seen the Bell charts, which show just how important it is to limit contact with others in settings like these during outbreaks. They clearly show how sensible policies, such as the governor's limitations on public gatherings, in turn limit the spread of viruses. This approach has proven effective in containing outbreaks and limiting them to a smaller number of people that is manageable by our hospitals, so victims can be more effectively treated. This is an additional precaution to what we can't stress enough, which is to practice good sanitation by frequently washing your hand, wiping down surfaces, and also practicing social distancing, which is to keep a 6-foot distance from others as much as possible. I would encourage you to get more information by going to our website at detroitmi.gov/thecoronavirus. And again, together we can help to slow the spread.
Okay, questions?
Can you tell us, if it's possible, Dr. Zervos, Mayor,
Doctor, come on.
how many people in the city have been tested so far, if you know that number?
It's a relatively small number.
Do we know the number?
I can't give you the exact number, but it's.
Mayor, have you been tested?
I have not. So there is a whole protocol. Doctor, you can tell. Doctor, why don't you explain what the protocol would take?
Yeah, so the protocol has been that if somebody had traveled from an affected area, if they were exposed to somebody with known case of coronavirus, if they were hospitalized with a severe infection that we didn't know what the reason was, that we were able to test them and And up until last week, there were really only a few people that were tested. But that's opened up significantly now. I don't know what the numbers are, but over the last just few days, through last week, it's really exploded in terms of the number of tests that we were able to do. We don't have the restrictions on testing that occurred last week. I don't know what the numbers are right now. I didn't look at it, but if you go to both the CDC and the city, the CDC, the MDHHS have really good websites. They're reliable sources of information, and so the MDHHS website, the COVID site, has an up-to-date list of how many were tested, how many presumptive positives, how many positives. So, and I don't know the number right now, but it's in the hundreds. I don't know how many of those are.
It's on the State Health Department website right now,
Yeah.
Overall. But if Dr. Zervas wanted to get me tested, and with all of his influence, the fact that I hadn't traveled, the fact that I haven't had primary contact with somebody confirmed, he could not have gotten the test approved.
Yeah,
right?
but I would try to give reassurance that the testing's not needed. So we get a lot of questions about who to test and who not to test, and it is if there is if somebody is sick, then we want to try to find out what's wrong with them. If there is, and especially if there's been an exposure, so we're pretty careful in asking where somebody has been, if they traveled, if they've been around somebody else who's been sick, kinds of questions. And if there's a potential contact, then we're much more aggressive now in testing for COVID. But and the ability for us to test has opened up a lot, so that we don't have the same restrictions that we had before.
We're hoping within a week or two we have the basically free ability to test everybody.
Appreciating you don't know the numbers and direction. Earlier this week, Bernie Sanders had a news conference that was attended by Yale epidemiologist Dr. Galvani, who said in 3 weeks her estimation was we'd be out of ICU bed space in this country. Ohio comes out with 117,000 projected infections. Where is it going as far as the stress on the system, alternate sites set up for people that need ICU care? Give us an idea.
So we are going to see more cases, and seeing more cases is going to be because we're able to do more testing, and it's impossible to predict exactly how many cases we're gonna have, but we do know that it is a very contagious virus. It is actually a more contagious virus than what influenza is, and we see millions of cases of influenza every year. It is, and there are all kinds of estimates of how many cases we're going to see. We do know that the majority of the patients are either asymptomatic, have mild illness, don't require hospitalization. The 20%, however, that do need hospitalization, and then a fewer number that need ICU care, is a very significant concern. And there are plans from the hospital point of view to look at where we are now, what is needed if there is an increased number of cases, how do we deal with surge capacity, and those are areas that are being looked at. It's impossible to predict how many cases we're going to have. We know that we're going to have more cases. Most of us believe that there's going to be a significant number of new cases. But I want to get back to the point that was made earlier about lowering the curve. What we really want to do is we don't want to have the spike in cases that is going to result in a massive increase at once that is going to totally overwhelm everybody. What we're really working towards is to try to implement control measures that'll, so to speak, flatten the curve, meaning that if we see cases, which we know we're going to see a lot of cases, that we're able to not have that spike, where we have the same amount of cases over a longer period of time where the hospitals can handle it. But there's a lot of preparation that's going on in the hospitals to deal with the type of surge that is possible. And what I think was really critical that's been done here in Detroit is that there is a partnership that is between the health departments, the hospitals, the universities, community groups, that to get ourselves together and to work together to fight this. And because the hospitals are one piece of it, and controlling, a surge of cases in the hospital is one thing, but we all have to work together with this, because it is is a role that's going to involve all of us.
So we can talk about ICU capacity, the doctor and I, until we bore you to tears, but it is something that I'm going to talk about with the hospital CEOs. Right now, influenza A is running very high. It's using up a bunch of those beds. Historically, seasonal flu has dropped off significantly with the temperature. This is why we keep saying slow the growth of COVID-19. If we get influenza down, we've got capacity in the ICUs, we're in a position to handle it. If not, there are a number of hospitals in this region who have got closed facilities that on a contingency could potentially be reopened. We're going to try to manage the growth to the point that that doesn't happen, but we are totally on top of it, and people can put all the numbers out there that they want. What we know for sure is if you can slow the growth, we can get through this in a positive way. Yes. Good.
Can you elaborate what this 3-month program is going to look like now that we're seeing certain centers closed down?
So I want to let Dr. Vitti, that's Dr. Vitti's program, and I'm supportive, and I think it's more appropriate for him to tell you his plans. He has a very thought-out plan that I understand is going to start next Wednesday, but I would not, it wouldn't be appropriate for me to tell you his plan. Yes.
Archbishop Vigneron announced this afternoon he's going to suspend public mass until the first week in April. I'm wondering, Dr. Zervos, if you knew about that, if you think that that's prudent or overly cautious, and if you would recommend that other denominations consider similar decisions.
I think it's prudent to limit large gatherings and to look at alternatives for large gatherings. So, and that's being done now across the city. So, I'm also part of a group at Wayne State, and so Wayne State University has looked at doing the classes, especially actually doing all classes, as distance learning. I think that the churches are different issues involved, but I think looking at ways to limit the number of people going to services, maybe having more services before fewer numbers of people is potentially an option. Doing things more from a online or distance, can be done. But I think it is prudent to limit the large gatherings. I'm not going to recommend closing churches, but it is something that gets back to that point about the trying to separate people, limit the size of the group. But the other thing that's important about it, including for the churches, is that if somebody is sick, they shouldn't be going to church. And it's not just for the other people that are there, but it's for themselves too. That if somebody is sick with coronavirus, especially since we don't have specific treatments for it. We do have supportive care, and early care is important, and there are experimental treatments, but it's important for somebody to just be home and rest. So even just for the person himself, it's important.
And are you aware of, or have any sense of whether there's a timeline where if we do everything right for 3 months, we're golden, or is this open-ended and we're going to see this thing change on a regular basis?
That's a really important question, because it is now there's a restriction on closing schools and one thing or another, but it's really impossible now to tell how long this is going to be needed. We do expect, I think every health expert now is expecting that we're going to see more cases. How many more cases, though, is not only very difficult, but it's impossible to predict, because it depends on the virus. It also depends on how good we are at trying to control the infections. It's likely that we're going to see more infections for a while, likely even several months, but hopefully we can get it to a point where we see this increase because we're doing more testing, but then it levels off and starts to drop off. But we can't say it's going to disappear in the summer. It's going to disappear in 3 weeks or 4 weeks. That most of us think that it is going to continue to increase and then hopefully level off over the next several months.
Appreciating you're looking forward, I'm curious though, is it because of lost time? I'd be interested in your reaction to an element of, we lost a few weeks on a national level perhaps, and this was allowed to expand, and did it cost us? I'm not trying to assess blame or et cetera, but I'd be interested in your thought in regard to, are we late to the party here in regard to what we're trying to do?
Well, testing early is important, and the reason it's important is because we can we know where it is and we can implement control measures. It is, and it's still important now because we still need to be able to do more testing, and including in vulnerable populations. We need to, people that are in nursing homes, that are in homeless shelters, and other vulnerable populations. We still need to be able to do more testing. So the testing is the first step. Doing early testing is important, and the earlier the better. Then the next step is then to do the control measures once we've identified patients. All of that is better done earlier than later.
What do you think should happen with casinos when we're talking about limiting large gatherings? That can be good for you or for the mayor.
Yeah, I'm back to the same thing. I thought what the governor did today in limiting gatherings to 250 was a really good thing. So the question is not what's the kind of business. The question is, are you compressed to the point where you're within 6 feet of somebody else, you're exchanging breaths and the like, and I think the 250 person limit was a very prudent thing for the governor to do.
Mr. Mayor, there was a report on social media that the 2 EMTs are in isolation after having contact with someone who was at medium to high risk for coronavirus.
So I don't want to talk about privacy in any individual case. Let me just tell you our policy. If somebody has primary contact, whether you are an office worker, an EMT, a police officer, if you have primary contact with somebody that a doctor deems to need a COVID-19 test, you are quarantined until that COVID-19 test comes in. And that is a policy we are applying in the city across the board. And so you would expect if somebody had contact with somebody, they would be quarantined until the test results came back.
So we don't have any names attached to this, so we're not looking to identify anybody. But if you don't want to narrow it down to EMTs, can you tell us, are there any city employees?
Again, I'm going to tell you this, that we do have city employees. Literally, we have a team we call Medic 19 out of our EMTs, actually, who are responding. And I don't know, we've looked at 15, 16, 18 individuals who came in. My sister's in this situation. I was at this location. And in each individual case, we handle it appropriately. Dr. Zervis did the same thing with the Pistons very shortly ago in determining people who were in primary contact, quarantined for an appropriate period of time until tests come out. So I can't, from a patient privacy standpoint, say anything else other than literally every day, anybody who has had primary contact with somebody where a COVID-19 test has been ordered is self-quarantined until the results come in. If the result comes back positive, that person is self-quarantined for 14 days. We have not had anybody quarantined to 14 days yet. But we are being very, very careful for our employees. The reality is you got businesses who can send people home and shut down. The city of Detroit delivers service to people. We can't shut down, but I have to make sure our employees are as safe as possible, and that's why we've adopted this quarantine policy.
Can I make a comment?
You sure can.
So, an important point about that, is, which we get this question all the time, is that, so we have a case. We have a, defined case of coronavirus. So anybody who's been in contact with that individual then goes in quarantine, and if they have symptoms, then they get tested. But then we get this thing, question, well, okay, we've got the COVID patient, and then the, household contacts that have been in contact with that patient, they qualify, but then what about the contact of the household contact, their school teacher or whatever it is? Then those we're not recommending because, it gets, those secondary contacts are not at risk. If it turns out that somebody who was in contact with the first patient gets coronavirus, then people that were in contact with that person would then get tested. But we're not, because you could drag that out, to several different degrees, which would not be necessary, wouldn't be warranted.
Can you go over test kits again one more time, please, and forgive me? Availability, but also I've seen reports of kits that can take up to 4 days. The national distribution might be slow. Hospitals developing their own that are faster. I mean, what kind of collaboration do you have on kits, and do we have enough?
So the state currently the process is that a provider needs to call calls the county health department and then the state health department. They approve us doing the testing. There were some restrictions in that before. That's now opened up, and the state does the testing, and the testing is then for free, depending on when we get the sample to the state. Then usually we get back the result the same day. If there's delays in getting the sample to the state, then there's delays in getting back the result of the test. There's an initial presumptive positive, and then it gets confirmed after that if it's initial positive. The issues with the testing included that there were some issues with how many kits we had initially in the United States, and then issues with some of the reliability of the test and recalls and then reissuing. But we do have enough tests now at the state health department. There's still this process of the having to call the state, fill out forms, and all of that is appropriate because it is important for the state and the health departments to have information on who we're testing, information that they can then trace back if somebody's positive, what to do. The hospitals, however, we do testing all the time. Henry Ford Health System has 3 million people that go through our health system every year, and we do millions of laboratory tests. So the hospitals do have much more capacity to be able to do testing, and the hospitals are looking at developing the testing on our own. There have been limitations in that. Also, there are regulations that the FDA has for starting new tests that have recently been lifted. So all of that has resulted in a slow process and to get back to your earlier question, it would have been better that we had the testing earlier.
Has there been any discussion in terms of people who are reticent about getting tested, who may have been exposed? Because we're in an urban city, people may not necessarily trust the government. Talk a little bit about that. Have there been discussions about people like that who you would encourage strongly to get tested once these tests are?
So there are always, there's always questions about getting tested or not, and it's important for providers to explain why a test is going to be done, what are the implications of it. We've actually seen the opposite, that people want to get tested, and we haven't been able to do all the testing that's been necessary. There have been those kind of issues in other countries, and because actually we do work in. Our work includes work in Wuhan. I was actually in Wuhan before the epidemic occurred, and we still have contact. Don't worry, everybody is safe here. Don't worry, we're in a group with it. Don't worry, I was there before, but so we still have contact with the people there. So they're of course they're afraid to get tested because they're going to get dragged off and put into isolation. So there are things that exist in other countries that don't exist here. Here we really haven't had anybody that has refused the test. And in contrast, we've had people that have wanted it, and we haven't been able to do it as much. It hasn't been a problem here. Yeah.
Mr. Mayor, you referenced that you wouldn't go to any of the pubs on Michigan Avenue on Sunday. There's been some talk that some of the pub owners may try and arrange a bus service to get people from bar to bar to bar. The St. Patrick's Parade has been canceled. Have you been consulted? Have you expressed your concerns to I have expressed concerns to business owners, but mostly we're expressing concerns to the public. If you go to a pub that has a lot of space in it and enjoy an afternoon with a friend, that's not a problem. If you're packed shoulder to shoulder on a bus, that is a high-risk activity right now. And so what we're really saying to you is that we don't want you to stay in your house, but you have to be sensible. And it's all about the density of your environment, how close folks are. And the doctor will say to you over and over, you don't want to be within that 6-foot limit to groups of people. So I think there's a way for people to have fun, but
I don't want to see people packed in shoulder to shoulder on Michigan Avenue as they are. A year from now, I think they'll probably be able to. But this year, you are doing the people of this community a disservice. There is no doubt there are a lot of people in this community who have the coronavirus who don't know it. And so we are really saying, please stay away from these tight spaces. Doctor, you want to say it better than that?
No, I just want to say to please remember the simple measures that we know are effective, and those are hand washing, to not go out if somebody is sick themselves, and not to be too close to somebody, particularly who's coughing and sneezing. That's the most important thing. I actually had dinner last night on a restaurant on Michigan Avenue. So it was, and I didn't feel any risk or any concern, whatsoever. So I think we still go about our daily lives, but some common sense measures are needed, which are hand washing, the social distancing, the large groups, and then, not going someplace if we're sick ourselves, and also to seek medical attention if there's an illness, so that we can know what's wrong and better deal with the illness of the person themselves, but also with the community. And most things are still, we're still seeing influenza, we're seeing other viruses in this area, so we're seeing other infections that are causing, similar symptoms. So and some of those are treated. Influenza can be treated with antiviral drugs, so there is still importance to see a physician, even if it of course turns out to be something else.
So Dr. Zervos does live in the city of Detroit, and he's in these restaurants every night.
So go back to that Michigan Avenue. Are you recommending that people not take the buses if they're planning to visit the pub?
Go ahead.
Meaning the pub buses as opposed to the city buses.
No, I'm not saying I'm not saying that. I think if somebody is, if I got on that, I would feel safe being on that bus. But I would try to avoid situations like the mayor said, where people are packed in, closely together. I think that is prudent, and if somebody was coughing, I would move away from them in that situation.
Mayor, as a technical aspect of the team, you referred to the doctor as the general. As far as, can you talk about your appointment here?
Yeah, I got the general and the colonel here. With Dr. Reyes.
Formally then,
So.
he heads up city efforts?
So Denise Fair, as our health director, heads up the city efforts, but you never know when you're in the health department what expertise you need. And when we ended up with a country's biggest infectious disease scare in, at least a century, we went to the expert. And so we were together at 7 o'clock this morning in the initial meeting where he's giving us guidance. 7 o'clock Monday morning, we'll be in again, and we just bring a list of questions of decisions, and there are a lot of human questions all the time, and the doctor's just been an enormous value, and he's promised that he and Dr. Reyes will stay with us until the coronavirus is under control, right?
Yeah, so my role is a consultative role. My full-time position is the head of infectious disease at Henry Ford Health System. I also have a position as Assistant Dean for Global Health at Wayne State University School of Medicine. I don't have any type of formal public health job or appointment. This is being done as a consultant, and Henry Ford Health System and Wayne State University have been, and the other hospitals all feel that we need to get ourselves together to work on this. But it's not in a formal role.
You've got a badge and a parking space.
I do have I got a really nice parking space. Yeah.
Can I ask you one, at least from me, and again, it's going to sound like I'm trying to assess blame here, but it's been interesting that a lot of these actions have been taken on state levels.
Have you figured out that we are not going to answer that question?
Well, there's been vacuum, though.
We all know the answer to that, and it does. You can ask the doctor 12 times, and he will answer you the same way 12 times. So there is no point in spending a lot of time on that. If we had an abundance of test kits a month ago, there would have been a very different strategy than what happened. But we can spend our time talking about that, or I am very hopeful that within 2 weeks, these labs will be approved, these drive-by testing programs will be in place, And it certainly would have been better to have it earlier, but we're not going to spend our time looking backwards. We're going to build what I hope to be the most aggressive COVID-19 testing program in the country and hold down the growth of this virus. That's what we're going to do.
How many drive-by testing facilities do you need?
So I haven't had the meeting yet. So I'm talking to each of the hospital system CEOs, and we're going to meet here next Monday. So when we do that, and most of them were heading down this road anyway. It wasn't like I came up with some idea nobody ever thought of. Everybody was working on this anyway because nobody wants these contagious patients in their waiting room. So we've got tremendous healthcare systems here, and we're going to put them to work for us.
Will the city be approaching FEMA now that a national disaster has been announced?
And so you have a whole number of things. For example, as I understand it from the hospitals, the fact that the disaster has been announced means they don't have to worry about, we can send people to test in homeless shelters, and we're going to get reimbursed. These are things that may sound small to you, but they are really important in the practical side of rolling things out. And so we're working through what all of that means right now. But it feels like, based on my conversation with the healthcare systems, they're ready to go full blast regardless of ability to pay, which you turn these healthcare systems loose, they are really good. All right, anything else? All right, thank you all very much.